What if the very health tests you trust the most, the ones meant to protect you, could quietly shorten your life instead? Millions of seniors line up every year for routine checkups, convinced they're staying safe. But shocking new evidence shows that after 70, some of these tests can do more harm than good. We're talking about pushing you toward unnecessary surgeries, strokes, or even triggering cancer itself. In fact, studies reveal up to 37% of medical tests in seniors lead to harmful overtreatment, and 99% of seniors have no idea they're being overtested. Here's the part your doctor will almost never tell you. One of these so-called preventive tests is now linked to 5% of all U.S. cancer cases, the same damage caused by drinking alcohol every single day. That's not prevention, that's danger wrapped in a white coat. Today, we're exposing the 5 checkups you should avoid after 70, backed by science and real patient stories. Wait until you hear what landed at number 2. It's a test you've probably had more than once. Before we dive in, drop a comment below with your age, where you're watching from, and whether you've ever regretted a medical test or procedure. Do you think seniors are tested too much? We reply to every single comment with personalized tips. And don't forget to hit like and subscribe, because what you're about to hear might just save a life. Now, let's start with a test that looks harmless, but can quietly ruin your quality of life. Checkup number 5, bone density scan. On the surface, a bone density scan, or DEXA scan, looks like the safest test you could imagine: quick, painless, no needles. But here's the truth. After 70, it often creates fear without benefit. Nearly all older adults will show bone loss on this scan, because bone thinning is natural with age, just like gray hair or wrinkles. Doctors often rush to prescribe bisphosphonate drugs. These are supposed to strengthen bones but can trigger horrifying side effects like jaw necrosis. Yes, your jawbone literally dying, severe acid reflux, or brittle, oddly breaking bones. A study in the Journal of the American Geriatric Society tracked 1,200 women over 70. After 5 years, the drugs reduced fractures by just 0.3%, but caused far more pain and complications. Take Rose, a 76-year-old piano teacher. She was healthy, never had a fall, yet after one DEXA scan, she was put on medication. Within months, she had such severe reflux and jaw pain that she couldn't even play piano. Once she stopped the drugs and switched to vitamin D, calcium-rich foods, and simple strength training, she returned to recitals, stronger than before, with no fractures. Bottom line? If you're over 70 and not breaking bones, skip the DEXA scare. Focus on lifestyle, resistance exercises, balance training, vitamin D, and nutrition, which a 2022 Osteoporosis International study proved can reduce fractures by over 20%. But as bad as that is, the next test can land you on an operating table, sometimes for no reason. Checkup number 4, brain MRI for memory loss. Forgetfulness is terrifying. So when seniors start misplacing keys or forgetting names, doctors often order a brain MRI. Sounds responsible, right? Not really. Here's why. Most MRIs after 70 show abnormalities, white matter spots, mild shrinkage. Yet these are completely normal aging. But once those images exist, they often trigger fear, panic, and unnecessary invasive procedures. A 2021 Neurology Today review of 3,000 MRIs in seniors found 86% showed abnormalities, but only 3% were treatable. Worse, 12% of patients were sent for spinal taps or even exploratory brain biopsies, procedures that caused trauma but solved nothing. George, 74, had a scan after mild forgetfulness. It showed harmless spots, but he spiraled into panic, convinced he had dementia. He stopped driving, withdrew from church, and his anxiety actually worsened his memory. When retested, his brain was perfectly normal for his age. Unless you have seizures, sudden personality changes, or rapid decline, MRIs rarely help. Instead, start with a simple cognitive screening test, cheap, effective, and zero risks. Checkup number 3, cardiac stress test. The cardiac stress test, walking on a treadmill while your heart is monitored, seems like a good idea. But after 70, if you're not showing classic heart disease symptoms, this test can backfire badly. The false positive rate can hit 40% in older adults, leading to risky follow-ups like angiograms, stents, or bypasses, procedures that often provide no survival benefit. A 2017 JAMA cardiology study showed that more than half of stents placed after stress test referrals were unnecessary. Patients saw no improvement in survival, but did suffer higher bleeding, kidney injuries, and long hospital stays. Raymond, a 75-year-old postman, felt mild fatigue on hills. A stress test led to a stent he didn't need. He ended up with kidney problems from the contrast dye and spent a week in the hospital. His fatigue? It wasn't his heart. It was dehydration. If you're over 70 without chest pain or shortness of breath, skip the treadmill. Safer options: a resting EKG or coronary calcium scan. But even those risks pale in comparison to what comes next, the test that's quietly harming seniors every single day. Checkup number 2, colonoscopy. Yes, the colonoscopy. After 70, and especially after 75, the risks outweigh the rewards for most seniors. Preparation can cause dehydration and kidney issues. Sedation increases dementia risk. And complications like bleeding or bowel perforation are far more common in older adults. A 2019 JAMA internal medicine study of 1.3 million seniors found that for every 1,000 colonoscopies after 75, only 2 lives were saved. But more than 20 seniors suffered serious complications. Dana, 73, had a routine colonoscopy despite no symptoms. A tiny polyp was removed. That night, her bowel perforated. 9 days in the hospital later, she was never the same. The U.S. Preventive Services Task Force recommends stopping routine colonoscopies at 75. For healthier seniors, safer alternatives exist, like a fit stool test done at home, no sedation, and still highly effective. And now, the most dangerous checkup of all. Checkup number 1, full-body CT scans. Marketed as executive health packages, these full-body CT scans are sold as cancer prevention, but in reality, they're cancer causers. Each scan delivers radiation equal to 500 chest X-rays. A 2023 JAMA internal medicine study estimates CT scans now account for 5% of all U.S. cancers, the same as daily alcohol use, and most findings are harmless nodules or cysts, but once spotted, they spark endless tests, biopsies, surgeries, and sometimes devastating complications. Marcus, 80, felt healthy. His scan revealed a harmless 3-millimeter nodule. He was sent for a biopsy that collapsed part of his lung. Months of recovery for nothing. The American College of Radiology warns, full-body CT scans should never be used in symptom-free adults. If you have specific issues, like unexplained weight loss or cough in blood, targeted imaging makes sense. Otherwise, you're playing with fire. Final word. So there you have it, 5 checkups that may look helpful but can secretly harm seniors over 70. The golden rule? Always ask your doctor, if this test finds something, what happens next? If the next step is risky, invasive, or uncertain, think twice. Real prevention isn't fear-driven testing, it's lifestyle. Eat well, sleep deeply, stay active, and focus on balance and strength. Now, we want to hear from you. Have you or someone you know suffered from a test that wasn't really necessary? Share in the comments below. We read and reply to every single one. And don't forget to like this video and subscribe for more science-backed health truths that could save your life.